How does the U.S. health system work? Healthcare in the United States is organized in a complex bureaucracy. While in the rest of the world healthcare facilities are owned mostly by governments or by private sector businesses, in the U.S. a large share of hospitals and clinics are owned by private nonprofit organizations. Yet, the United States is the country that has the highest healthcare expenditures in the world. While these expenditures are covered in a large share by public payers as by federal institutions, or state and local governments, they can also be covered by private insurance and individual payments. At the same time, unlike most developed nations, the U.S. health system does not provide healthcare to its entire population. As there is no single nationwide system of health insurance, the United States primarily relies on employers who voluntarily provide health insurance coverage to their employees and dependents. In addition, the government has programs that tend to cover healthcare expenses for the fragile parts of the society as the elderly, disabled and the poor. These programs differ from one another, and all have a specific kind of people that are subject to. Getting health insurance in the U.S. is not an easy thing. Someone may think that once you have money everything is easy peasy, but in fact things are a bit more complicated. One must be very careful and look out to pick the right insurance. Health insurance in the United States for non-citizens. The United States government does not provide health insurance for all its people, and health insurance is not obligatory for those living in the U.S. It is optional, but highly recommended and necessary since health services are very costly, more than in any other country anywhere across the globe. There are two types of health insurances in the U.S., private and public. Most people use a combination of both. The U.S. public health insurances are Medicare, Medicaid, and Children's Health Insurance Program. Travel insurance for visitors in USA. Health insurance for international students in USA. Health insurance for dependents of international students. Health insurance for J-1 visa holders. Health insurance for foreign workers on an H-1B visa. Health insurance for dependents on an H-4 visa holders. Health insurance for green card holders. Health insurance for K-1 visa holders. Health insurance in USA for Canadian expats. The U.S. has the most expensive healthcare in the world. That's why getting adequate health insurance coverage comes highly recommended. Medicare. Medicare is a national health insurance program that dates back to 1966. It provides health insurance for U.S. nationals older than 65 years old, but also for younger people with end-stage renal disease, ALS, and some other disabilities. Data shows that in 2018, Medicare provided almost 60 million individuals with health care in the U.S., over 51 million of which were older than 65. The Medicare program is divided into 4 parts. Part A, which covers hospitals, skilled nursing and hospice services. Part B, covers outpatient services, including some providers' services while inpatient at a hospital, outpatient hospital charges. Part C, is an alternative called Managed Medicare, which permits patients to select health plans with at least the same service coverage as Part A and B, often the benefits of Part D, and an annual out-of-pocket spend limit which A and B lack. To sign in this part, one must sign in Part A and B first. Part D covers mostly self-administered prescription drugs. Medicaid. Medicaid is a federal and state program that helps people with limited income and resources to cover medical costs, while covering benefits normally not covered by Medicare, as nursing home care and personal care services. It is the largest source of funding for medical and health-related services for people with low income in the United States. Data shows that the U.S. provided health insurance to 71 million people with low income or disabilities, which is 23% of the total of the U.S. population. Children's Health Insurance Program. Formerly known as the State Children's Health Insurance Program, SHIP. This is a program that covers with health insurance children of families with modest income, that are not low enough to qualify for Medicaid. The Affordable Care Act, Obamacare. The Patient Protection and Affordable Care Act is a federal statute signed into law by President Obama, which made it mandatory for every citizen to have health insurance or be penalized. The act subsidies for low-income families by taxing healthcare providers and high-income families, as it was designed to lower healthcare costs while providing better healthcare for Americans. The Affordable Care Act allowed parents to add their children up to the age of 26 to their policies, in a bid to have younger healthy people paying premiums. It also allowed poorer people to get treatment for chronic illnesses instead of using the emergency room. U.S. private health insurance. There are about 1,000 private health insurance providers in the U.S., with each of them offering different plans with different prices, which largely depend on a person's medical history. However, while there are individual plans, covering only one person, there are also group plans targeting families in particular. Usually, there are 3 types of health insurances in the United States. Traditional fee-for-service health insurance plans, which plans are